Hi everybody, I'm Dr. Sohi. I've had a lot of people ask me about Cologuard and colonoscopy lately, and so I wanted to talk about these and other colon cancer screening tests. Colon cancer is the third leading cause of cancer-related deaths in America, and it's highly preventable. If found early, the 5-year survival rate for colon cancer is greater than 90%, but that drops to 39% if found in later stages. That means early detection and prevention are key. According to the United States Multisociety Task Force on Colorectal Cancer, which represents multiple GI Society recommendations, colonoscopy is the #1 recommended screening test for colon cancer. Colonoscopy is not only diagnostic, it's also therapeutic, meaning that if we find something, we can immediately do something about it. Cologuard has become a popular test in recent years. So what is Cologuard? It's a stool DNA screening test for detecting colon cancer. It's non-invasive, can be done at home every 3 years. It sounds pretty great, right? A lot of people are getting this test. So why is it not a first-line recommended test for screening for colon cancer by the task force? The task force recommends a colonoscopy as the first-line evaluation for colon cancer screening. But in those who cannot, they recommend a different stool test. It's called a fecal immunochemical test, or a FIT test, and is non-invasive and can be done annually. Though Cologuard would be done every 3 years, it is still more expensive than an annual FIT test. I understand the hesitation to undergo a colonoscopy if there were an equally effective non-invasive screening test available. The problem is, nothing is as effective as a colonoscopy for diagnosing and preventing colon cancer. With a colonoscopy, we are able to find and remove small polyps before they become anything big. If your colonoscopy is negative, you're cleared for 10 years. It's kind of a one and done thing. With Cologuard, many gastroenterologists are concerned that it is being done in the wrong patients for the wrong reasons. It should not be done if you would not do a colonoscopy anyway or cannot do a colonoscopy due to other illnesses, because if it is positive, that would be what is recommended. What's more, a positive Cologuard changes your colonoscopy procedure from a screening procedure to a diagnostic procedure, because now there's an established problem, and that can possibly change your copay, meaning you may find that the procedure is not covered by your insurance. The false positive rate for Cologuard is fairly high, on the order of 40%, which means it's positive but nothing is found on the subsequent colonoscopy. This can lead to unnecessary anxiety and urgency for the follow-up colonoscopy. In a study funded by Cologuard in the New England Journal of Medicine, Cologuard found 93% of cancers detected by screening colonoscopy. That sounds pretty good, but that's a 7% miss rate, or a failure to detect colon cancer in 1 in 13 people tested. It also missed more than 30% of advanced precancerous polyps and 57% of precancerous polyps. Cologuard should not be offered for individuals at high risk of colon cancer, including those with a history of polyps, inflammatory bowel disease, or a family history of polyps or colon cancer. Cologuard should not be offered to patients who have any GI symptoms. The Multisociety Task Force on Colorectal Cancer does recommend Cologuard as an acceptable second-line screening option for colon cancer. The task force recommends that colonoscopy be offered first, but if declined, an annual FIT test should be offered as a non-invasive option, followed by second-tier tests, such as Cologuard every 3 years, CT colonography every 5 years. This is also known as a virtual colonoscopy. This is a radiology test that still requires a bowel prep, and while less invasive, does expose you to radiation, and if positive, would require another prep for a regular colonoscopy to remove what was found. A flexible sigmoidoscopy every 5 to 10 years. This scope test looks at the bottom 1/3 of the colon, so while it does reduce colon cancer numbers, it cannot evaluate the first 2/3 of the colon. And finally, third-tier testing involves a capsule colonoscopy every 5 years. When you're considering your colon cancer screening options, please remember that any test is better than no test. But prevention of colon cancer is always preferred over detection. Thanks for watching, and please drop any questions below.